go straight into panel discussions. Before we go for panel discussions, I have a surprise for you. Okay? I have a surprise for you. So let the good lady introduce herself. I had mentioned her name before, and then I give you the surprise.
Boy, I'm just saying. Thank you so much. Morning, everyone. Morning. Don't mind my energy. It comes a little like this after I have consumed caffeine. So nilikunywa kahawa. Is that all right?
Yes.
All right. So morning, everyone. My name is Tina. Is it afternoon already?
Yeah.
Oh, by 19 minutes. So good afternoon, everyone. My name is Tina Masai. So I was to speak with you all earlier, but I had a little engagement, and I give you my sincere apologies for just disrupting the program slightly. I'm hoping you'll be willing to accommodate me for a few minutes. Is that all right?
Yes.
Yes? Is that all right on this side?
Yes.
On my right? Consent is key, eh? All right, thank you so much. So I will take you very briefly through what I had prepared for you for my keynote address, and then I will be part of the team that will be having a panel discussion. I would like to first of all say thank you to the YIDP team for a very excellent turnout, very exciting panels with really good discussions, and I was also learning a lot from the first section of the engagement. I was asked to talk about from policy to practice, integrating digital wellness in education, health, and labor systems. So I only have expertise in mental health and not in education and labor by a margin, but I will look at it from the context of what digital wellness looks like and how it can transcend all of those three systems. So education, health, and labor. I will take approximately 5 minutes, exceed sana maybe 7 minutes, and then we'll move on to the next stage. I think just to begin with, we'll talk a little bit about the digital landscape, which is what we already know. We know that Africa, mobile phones, we are doing well, right? If you look at the Communications of Authority data, our mobile penetration in the country is good. And that's reflective of the growth that's happening in Africa. So simply more people are having mobile devices in their hands than a decade or 2 decades ago. We also have an increase in the amount of internet access that we have. If you compare 10 years, 20 years ago, we are actually doing much better. But there are differences if you go urban versus rural. But now with this internet, with the mobile phones, technology is improving. Now we have a lot of AI adoption, and I'm glad to hear we are doing research on AI, responsible AI. But the people who are really moving with these new innovations are actually the youth. And those are the people who are actually the majority in the world, as well as in Africa and also in Kenya. But then again, when you turn and you look at statistics around mental health, when you're looking at mental disorders and when they develop, they actually start to develop very early. So you start to see people who have mental disorders by age 25. 75% of them, you saw those symptoms in their adolescence period. So that's actually very, very early. Then when you look at the data, I don't know if this is visible to you all, there was some preparation work we were doing for a paper that we are writing. So we were trying to see who are the greatest consumers of, spending a lot of time on mobile phones. And I think you can already see. What age is that?
16 to 24.
16 to 24 are the ones who are disproportionately spending the most time on smartphones. But then if you look, the women, the females, are actually spending more time. So if you were to take anyone 16 all the way to 64 years, it's the 16 to 24-year-old females who are spending the most time on the phone. And then if you look at 25 to 34, the males are spending quite a bit of time. But you see, this is the youth are spending 7.5 hours, 7 hours on smartphones compared to the rest of the population. So that's already telling you there's a lot of time that our young people are spending online, and that is going to translate into a couple of things. So again, I'm a private practitioner, part-time. So there are certain things we start to see in practice as a result of people spending a lot of time on social media. And I think Albert was already on it with the questions that he was asking. So he called it digital addiction. Addiction, when you are talking about people who are always on their